Emergency driving. In this section, we will cover some techniques regarding driving with lights and sirens. Whether driving on a non-emergency transport situation or responding to a call under authorized lights and sirens, an ambulance operator must follow safe driving practices. However, on emergency runs, a very significant hazard is added to the safe driving equation: the adrenaline and emotional rush that the operator experiences. This adrenaline and emotional rush can be so significant that, in their haste to get to the emergency site, operators will fail to drive in a responsible manner with due regard for the safety of all persons. The ambulance operator must keep in mind that he or she is not protected legally from the consequences of failing to maintain control or for reckless disregard for the safety of others. It is up to you as a professional to keep the stress and emotions of the situation under control and your attention focused on driving safely. Driving in a true emergency with lights and sirens does not necessarily mean that you should drive faster than normal to benefit the patient. In fact, depending on the type of care and condition of the patient, driving at slower speeds with gradual acceleration and smooth braking often result in improved pre-hospital care for the patient. Think of your lights and siren as they were intended, as signaling devices to make you more visible, not as an excuse to drive fast. If you are a volunteer or an on-call operator, you may be at home or work when you receive a call. Don't let your eagerness to get to the ambulance transfer into unsafe driving practices. While it may be legal for you to use a signal or courtesy light on your personal vehicle, you should never assume that other drivers see it and will respond in a predictable way. Before leaving your home base, plan your route to the emergency site so, once underway, you can concentrate on your driving. You should know which streets are one-way, which streets are most congested, where school zones are, and how to avoid railroad crossings. Plan the safest and most efficient route to the emergency scene. While en route, let the crew focus on providing care for the patient while you operate the ambulance. Try to minimize your communication with the crew and the dispatcher to enable you to focus your attention on the changing traffic situations. Don't allow anything to interfere with your driving. Scan carefully and constantly for potential hazards ahead. Cover the brake when you see the van waiting to pull out on the right. The driver seems to be waiting, and the van ahead waiting to turn left. The driver doesn't want to pull to the right in case you pass on the right, and he must wait for a break in traffic to make his left. Keep your speed low while the situation resolves. You're the professional. You have to be ready. Never assume other drivers can see your ambulance or hear your sirens. Look at the situation from the other driver's point of view. Today's vehicles are well insulated from outside noise. This, combined with the inside distraction of radios, fans, air conditioners, and telephone conversations, and just plain inattention on the part of many drivers, makes it difficult for drivers to know your exact location. Even when drivers hear you, there is no guarantee that they will yield properly or quickly. You must always anticipate the unexpected and be ready to respond. Think about positioning your ambulance where it will be most visible. For example, by driving to the left side of your lane, oncoming traffic and drivers ahead will get a better view of you. This also cues the drivers ahead about which way to pull over when yielding the right of way. At the same time, try to maintain a cushion of safety around your ambulance, even when driving in an emergency. Other drivers should be yielding to you. However, avoid getting too close to a vehicle ahead before the driver moves aside. The closer you get, the more difficult it is for the driver to recognize your ambulance in his or her rearview mirror. Once the driver in front sees you, he or she may brake abruptly before pulling over. Maintain your following distance until the vehicle ahead yields to you. Also, be aware of aggressive drivers who may want to draft behind your ambulance. If you have a persistent tailgater, have your dispatcher notify the police if you feel it is necessary. And keep a lookout for friends or family of the patient who, distraught by the situation, may unintentionally place ambulance operators and themselves in a hazardous situation by tailgating. After yielding to your ambulance, other drivers may pull right back onto the roadway, right into the path of the family member's car. Before leaving an emergency site, advise all concerned where you are taking the patient and explain the danger of their following directly behind you. In certain circumstances, there can be 2 or more emergency vehicles traveling together, sometimes a police escort, sometimes a fire vehicle, or in this case, a paramedic vehicle. Anytime 2 or more emergency vehicles are traveling together, the operator of the second vehicle must stay alert for other drivers who may not expect multiple emergency vehicles following one another. After yielding to the lead vehicle, they may pull right in front of the second vehicle. For this reason, the drivers of the following units must be especially alert for unexpected pullouts. As the operator approaches this intersection with a red light, he reduces his speed and is prepared to stop at the intersection and proceed slowly, advancing lane by lane as he makes sure each vehicle is stopped. This ambulance is equipped with an in-vehicle system that can control the traffic light, and it is activated. However, the operator cannot assume the control device will work, nor can he assume all traffic will stop. A green light does not guarantee a clear route. Even when you or your dispatcher is controlling the traffic lights, you still must drive with great care at intersections. Notice how the operator slows way down and proceeds to this busy intersection with great care. Here, he will be proceeding straight through the intersection. Where are potential conflicts with other drivers or pedestrians who may not see or hear the lights and siren? The driver at the head of the left turn lane could begin turning. The operator must make sure all cross traffic is stopped and waiting, including the driver that might be planning to turn right on red. With all traffic stopped, that driver may think he can quickly make a right on red. The operator will have to check both the left and right to be sure no pedestrians are crossing against the light, and his view of pedestrians approaching from the right is blocked by the waiting traffic. He must also keep an eye on the bicyclist. Bicyclists often ignore the rules of the road, and they frequently feel they can beat an approaching vehicle across an intersection. With so many potential hazards at a busy intersection, the operator must keep his speed very low, even with a green light. Driving an emergency vehicle does not give the operator the right to ignore the safety of the other drivers and pedestrians, even when one makes a mistake. It's clear that an intersection with a red light poses a very significant hazard, requiring the operator to stop before entering the intersection. But what if the light is green, and the green light has been on for a while, often referred to as a stale green light? Allow your ambulance to slow by placing your foot over the brake, and be ready to stop if the light changes. This will prepare you for a driver who might jump out the instant the light changes. Since the light didn't change, move slowly through the intersection, checking that traffic in all directions is stopped. Treating the green light with caution prepared you for this driver. You're the professional who must allow for other drivers' mistakes. The emergency site itself can also be hazardous. There are often other emergency vehicles, emergency personnel, onlookers, and perhaps debris and fuel from a motor vehicle collision. When you arrive, select a safe place to park. Whenever possible, position your ambulance far enough away from an active roadway so you can access outside doors safely. Remember that the police officer is in charge at the emergency site. Once parked, check traffic in both directions before getting out of your vehicle. Whenever possible, position your ambulance far enough away from an active roadway so you can access outside doors safely. Avoid parking where your rear loading door will be exposed to moving traffic. Many emergency personnel have been hit and badly injured by other motorists. Also, except in extreme emergencies, don't use your ambulance as a traffic barricade. Let another vehicle, such as a police vehicle, block and shield the emergency scene from traffic. Your ambulance is the most vital link between the emergency scene and getting adequate care for the injured. Once the patient is on board, don't rush to get underway before you are satisfied that your travel path is clear. Sudden acceleration of your ambulance will not give other traffic time to react to your lights and siren, and could be harmful to those in the back. Use other emergency personnel, such as police, to hold traffic for your ambulance. Drive defensively and proceed with caution. Coaching reminder points. Remember to stop at red lights and check traffic before proceeding. Remember to continue scanning at the emergency site. Remember to continue to scan for others who may not hear or see you. Remember to cover the brake and scan when approaching an intersection.